Good afternoon again, everyone. We're going to start momentarily. We ask that you would please mute your phones unless called upon, and we're going to begin in about 4 minutes.
Hello, everybody.
Hello, hello.
Hello. Hey, Rebecca, Dr. Kennedy.
Hey, how are you?
Keisha.
Good. How are you guys? Staying safe?
Trying to.
Yes, yes.
All right. Good afternoon, everyone.
Good afternoon.
Yeah.
I'm glad to see everyone's faces, those that we can see. We ask that if you would please identify yourself, just because the Zoom link is a private, secure link. And for the public access, we have a YouTube link that is on our website right now. So whenever you get ready to join on, if you would please just put your name in that slot so that we know who you are. Okay. And it is 2 o'clock on the dot. Is the governor's office on? I know they were on. Is the governor's office back on? Yes, the 287 number is the governor's office. Yes.
Can any of them see it?
We are here.
Wonderful. Perfect. Well, we can begin. So again, I say good afternoon, everyone. For those of you who I've not had the pleasure of meeting, I'm Katara Williams. I'm the Chief of Staff for the Southern System. And we are very excited to begin this first meeting of Louisiana's COVID-19 Health Equity Task Force. We'll go ahead and start officially by having the roll call. If you would, just please, when you hear your name called, acknowledge that you are here. Ms. Gerald?
Good afternoon. Dr. Sandra Brown,
Here.
Dr. Thomas Levis. Senator Regina Barrow. Senator Regina Ashford Barrow. Dr. Earl Nupchis Benjamin Robinson.
Here.
Dr. Takesha Davis.
Here.
I just wanted to know. I didn't want to be not here.
Dr. Rebecca G.
Here.
Dr. Corey Abear.
Here.
Reverend Theron Jackson.
Here.
Reverend Raymond Jetson. Dr. Peter Kaczmarski.
Yeah, I'm here.
Dr. Kathleen Kennedy.
Here.
Mr. Mike McClanahan. Dr. Orlando McMeans.
Here.
Representative Dustin Miller.
Here.
Miss Judy Reese Morse.
Here.
Dr. Demetrius Porsche.
Here.
Dr. Rainey Whitfield.
That's Ronnie here.
Ronnie Whitfield. Dr. Gary Wilkes. Dr. Ray Belton.
Here.
Dr. Kim Hunter Reed.
Here.
Secretary Kimberly, okay, I have Dr. Reed. Secretary Kimberly Lewis Robinson.
She's here.
Dr. Katara Williams.
Present.
Dr. Adrian Wilson.
Here.
Did the Senator Regina Barrow join the line?
She's trying.
Okay.
Wonderful. Are there any names that were not called?
I'm Jane Ross. I'm with the Huey and Angelina Wilson Foundation.
Okay,
Wonderful.
thank you. Anyone else on the call? All right, wonderful. Well, we'll go ahead and get started. Again, I want to welcome everyone and thank you all so much for being here and agreeing, of course, to serve. This is the first meeting of the Executive Committee of the Louisiana COVID-19 Health Equity Task Force. Before we begin, just a few housekeeping items. Just remember to mute your phones so that distractions are limited. Also, if you have any public comments that are germane to this agenda, you can send us an email at public_comments@sus.edu, or of course, you can give us a call. We have someone monitoring the lines at 225-771-4364. Also, as you know, we are obviously in very unprecedented times. And of course, we're extremely grateful to the governor of this state for his transparency and his leadership during this time when communities across the state truly need it the most. So we will begin with an official welcome from our President Chancellor, Dr. Ray Belton, who's to my right, rather. And following President Belton, we will hear from our governor, Governor John Bel Edwards. And we're going to try to speed along this meeting. We're going to be as thorough as possible, but of course, move through as expeditiously as possible, being that the governor will be making his update today at 3 o'clock. Dr. Belton?
Well, thank you, Dr. Williams, for your diligence to date and for allowing me this opportunity to further express my appreciation to the cadre of experts who have joined us on this call. You should know that Southern University is truly honored to be a part of such important work during one of the most critical times in the history of not only this state, but across the globe. And I should say that this state is fortunate to have a fearless and selfless governor who leads by an example, and a governor who has the fortitude and courage to immediately tackle this pandemic. By way of this committee, we share a collective commitment towards seeking both short and long-term solutions to address the impact of COVID-19 on our most vulnerable populations. And to that end, I believe it to be an imperative that we are keenly focused on the goal of providing greater access to high-quality medical care and to improve health outcomes. Quite frankly, our citizens deserve it. Southern University has maintained a long-standing reputation of producing high-quality research relating to healthcare disparities for African Americans, and we are certain that under the leadership of co-chairs, Drs. Sandra Brown and Thomas Levis, that we are well positioned to carry out the charge that Governor Edwards has placed before us. So at this time, it is my honor and distinct privilege to introduce to you Governor John Bell Edwards, our leader of this great state of Louisiana.
Thank you, Dr. Belton, and thank you, Katara. I want to thank everybody for joining us this afternoon, and wherever you may be, I do hope that you and your families are safe and healthy. I'm very thankful that you all have agreed to participate in what I think is a very critically important task force. And the people that we've assembled, the people who've agreed to serve, are the absolute best in their fields, including many healthcare experts. Excuse me. I know how valuable your time is, and you've all got your plates full with other things, probably more than full, and that's one of the reasons why I appreciate so much that you've taken time out of your already busy schedule to be part of this effort. I especially want to thank Dr. Sandra Brown of the Southern University College of Nursing and Allied Health, but also Dr. Thomas Levis, who's the Dean of the Tulane University School of Public Health and Tropical Medicine, because they're going to be co-chairing this task force. What you probably are aware of is that the racial data that we've collected on COVID-19 deaths shows significant disparities among African Americans within our state. You know, I'm pretty sure that Louisiana was the first state in the country to announce that our data revealed racial disparities in deaths related to COVID-19. It really concerns me, and I know that all of you share those same concerns, which is why you've dedicated yourselves to finding out why this is happening and what we can do effectively to address it, both in the short term and in the long term. And what we've come to learn since we disclosed that information is that the data coming out of other states and large municipalities in many cases is very similar, but that doesn't mean that it's less alarming, and that we in any way shouldn't do what we can immediately to try to figure this out and make sure that we're doing better here in Louisiana as it relates to health equity. I think you all will acknowledge that the pandemic illuminated a problem that we've known about for a long time, but this problem has taken on a sense of urgency because quite honestly, we're seeing the deaths happening in real time in a very short order and on a magnitude that is unacceptable. You know all of that. I will tell you that today we added 401 new cases across the state of Louisiana for a total of 26,140, and sadly we added 61 new deaths for a total of 1,601. Beginning this week, the Louisiana Department of Health has added the racial breakdown of deaths in every parish where there have been 25 or more deaths. So that's not going to be every parish, but if you go to their public-facing dashboard, you'll see the racial breakdown of deaths as it relates to COVID-19 for those parishes with 25 or more. And you can view that at ldh.la.gov. The last time that we assembled the data on this, it showed that 56% of the deaths in Louisiana from COVID-19 are among African Americans. Another 8% are unknown. So I think it's pretty safe to say that right around 60% of the deaths happening across our state because of this disease have been in the African American population, whereas they comprise about 33% of our state's population as a whole. We know that also that there are certain comorbidities in addition to advanced age, which really predispose people to be more vulnerable to this disease. And in the order that appears, it's hypertension first, and then diabetes, chronic kidney disease, obesity, and heart disease. So this is what we're talking about. How do we get people to be healthier in the short term? What is it that they can do to better manage their disease, be healthier, be in a better position to withstand this virus should they contract it? And then over time, what can we do to reduce these health disparities and have more people be healthy? All of that is critically important. I want you to know that we're working really hard to further increase testing across the state. This is going to be even more important as we go forward, because as we are able to safely do so, we will slowly, gradually reopen different parts of the economy. We know that that's going to bring more people into contact with one another, even though we're going to continue to stress the need for social distancing and good hygiene practices and a lot of other things that we know actually work. So testing will be critical to inform what we do going forward. And then as we identify people who are positive, contact tracing is going to be critically important. So we're ramping up as quickly as we can our capacity for diagnostic testing, surveillance testing with respect to the presence of COVID-19, along with contact tracing. And then we're also ramping up the testing for antibodies, the serologic testing. And that's going to be critically important to us as well. We know that we need to be at between 140 to 150,000 tests per month. That's going to be a difficult goal to get to, but we're going to be able to do it. I feel very confident about that. The entire nation's focus on increasing testing capacity is already paying dividends, but there are some challenges associated with it. Not so much on lab capacity, but the challenges come in sourcing the sample collection kits, the swabs, the viral transport medium, the reagent, and so forth. But we just had a long call with the Vice President and the White House Coronavirus Task Force, and much of that call had to do with testing and the things that they're doing in order to promote increasing capacity over time. We really believe that we're going to get to 200,000 tests per month, which will be critically important for us. All of us need to share, and this is somewhere that you all can start helping immediately. We gotta share the message that there's absolutely no stigma associated either with being tested on the one hand or testing positive on the other. And I think that this is a byproduct of other issues. What are you doing down there, Kimberly? We're gonna get things done. All right, here we go. So there's no stigma associated with testing. We need people to test. And if they test positive, there's no stigma with being positive either. I don't understand that. I suspect that it may come from stigma that's been associated with other virus-related diseases and so forth in the past. And by the way, that should never be the case either, because to the extent that you have stigma associated with those diseases, then it's very difficult to get people to step forward, be tested, be treated, and then share information so that you can contact other people who might need testing and attention as well. So if you all could help with dispelling that whole idea that there's some stigma associated with this, that would be very helpful. We're actually protecting ourselves and our families, our communities, and everybody else when we get tested. So this is obviously very serious and important work that you've agreed to participate in, and quite literally, lives are depending on it, both in the short term and in the long term. And and not all of it related to COVID-19. That's the immediate challenge. But as we can make people healthier, better manage their diseases, keep them from getting the diseases in the first place, diagnose them sooner, get them into a position for managing the disease so that it doesn't progress more than is necessary. All that's critically important. And by the way, it benefits everybody. It doesn't just benefit the African American community. It doesn't just benefit the Latino community. It benefits everybody in the state of Louisiana. So we created this task force to provide recommendations relative to addressing these health inequities that are affecting the communities across the state of Louisiana. Again, that's been really illuminated by this coronavirus. You all are going to examine opportunities to provide greater access to high quality medical care, improve health outcomes, and we're going to have to look deeply into the social determinants of health and promote changes to behavior. And by the way, the social determinants and the behavior, these are things that have been with us for generations, and it's not really easy to break out of them, but we have to do this. And again, you all have been looking at these things forever. You've been chosen to participate in the task force because this really, in large part, your life's work. So I know I'm not telling you anything you don't know today. We do know that funding will be essential in order for this work to begin in earnest. I want you all to know that later today, I'll announce that $500,000 will be immediately available to the task force. This is possible thanks to the Irene W. and C.B. Pennington Family Foundation, the Baton Rouge Area Foundation, and the Huey and Angelina Wilson Foundation. A representative from each of these organizations are joining us for this announcement today. I know that we have Paula Pennington de la Breton with us, Bill Balhoff, David Beach, and I've got John Spain here with me at GOSEP. In addition, joining me today from the Health Equity Task Force, I do have Dr. Sandra Brown. Our two legislative members, and I know that Dr. Levis is in Baltimore today, so he's not going to be joining us. So in any event, you've got some goals that you've been tasked with, including providing reliable and data-driven information on COVID-19 safety and prevention, which obviously has a big component dealing with communication. But also providing the medical community with best practices and protocols for treating communities with underlying medical conditions and health disparities. And also ensuring testing availability and ease of access for all communities. These issues are complex and multifaceted. If the answers were easy, I suspect they'd have been found a long time ago. They'd have been implemented a long time ago. But I have 100% confidence that we're going to make tremendous headway because of the experience and expertise that you all share, but really because of the passion that you share for this issue and for our people. And I hope that the results of this task force will not only inform our response to COVID-19, but as I said earlier, help us address health emergencies in the future, but really just get our people to be healthier to begin with. If we never have a pandemic, that would be great. But we still have to do work around health and getting people to be healthier so that they can all have a better chance to reach their God-given potential. We also probably need to have a more robust, transparent health equity dashboard that will be public-facing and track our long-term success. So with that, I've talked to you way too long. You all need to get busy. And I've got a press conference in about 40 minutes or so that I have to get prepared for, but I'm going to be with you all for a few minutes longer before I have to sign off. So let me finish where I started. Thank you. Thank you for everyone that you are doing and that you're going to continue to do on this task force. And I wish you nothing but the best of success. And again, stay healthy. And try to keep your family that way too. That's critically important. So with that, Qatar, I'm going to turn it back over to you all.
Well, thank you, Mr. Governor. Again, I just want to applaud your leadership as we endeavor to navigate within this environment. I feel also compelled to really acknowledge Secretary of Revenue Kimberly Robinson for her diligence in facilitating the work of this task force, and as well Commissioner of Higher Ed Kim Hunter-Reid for their contributions. Qatar?
Thank you. Thank you again, Mr. Governor, of course, for your leadership and your transparency. We're cheering you on. We're cheering the state of Louisiana on, and we are committed and dedicated to this work. Our co-chairs are actually on the phone, both of them. I want to just take a moment to introduce Dr. Sandra Brown. Dr. Brown has achieved international prominence and has been doing lots of work to reduce minority health disparities and improve social welfare. The breadth of knowledge of her work has spanned over 2 decades, impacting the health outcomes of Louisiana citizens through her clinical research, practice, and academic leadership. She is nationally recognized for her exemplary work in promoting access to health care for the medically underserved and for her outstanding contributions during disaster recovery. Dr. Brown serves as an ambassador to the U.S. Department of Health National Health Service Corps. She holds the highest international honors bestowed to a nurse, which includes fellows by the American Academy of Nursing, fellow status as in the American of Nursing Education, and fellow status in the American Association of Nurse Practitioners. She's been inducted into numerous halls of fame and was named as one of the 8 great Louisianians of the year by the Louisiana Life magazine. Dr. Sandra Brown is currently our dean in the College of Nursing and Allied Health. We also want to introduce today to you co-chair Dr. Thomas LaVeist. Dr. Thomas LaVeist is Dean of the Tulane University School of Public Health and Tropical Medicine. He has written over 150 scientific articles, numerous mass media outlets, and is executive producer of The Skin You're In documentary series about racial inequalities in health. He is also the author of 6 books, including Minority Population and Health, An Introduction to Health Disparities in the United States. An award-winning research scientist, Dr. LaVeist has received the Innovation Award from the National Institutes of Health and the Knowledge Award from the USA Department of Health and Human Services, and was elected to the National Academy of Medicine. I present to you both today our co-chairs of this committee who will provide leadership and working towards exactly what Louisiana needs to reduce disparities in healthcare. Co-chairs Dr. Sandra Brown and Dr. Thomas LaVeist. Co-chairs.
Dr. Brown, do you want to go first or shall I?
Yes. First of all, I'd like to thank Governor John Bel Edwards for appointing a COVID-19 Health Equity Task Force. He heard our voices and he took action. Racial health disparities, as you have heard, is nothing new. It has existed long before this pandemic. For decades, Louisiana has ranked 49th out of 50 as one of the least healthiest states in the United States. What is new is the bright light that is shining on Louisiana that cannot be ignored. COVID-19 does not discriminate by race or gender. It is an equal opportunity virus. However, African Americans who contract it are disproportionately affected and have a higher death rate. We owe this important work that the task force is about to embark on to the lives that have been lost to the coronavirus. We simply cannot go back to status quo because everything has changed. This task force is a call to action, and we have a unique opportunity to use this pandemic to advance health equity. It is a privilege to serve as co-chair, and I thank each and every one of you for your commitment to serve. The work we do today will impact all of our tomorrows. Our citizens are resilient, and we will pull together to make our beloved Louisiana a place we call home, a healthier state for decades to come. If everyone does a little, we will accomplish a lot. Thank you, Governor, again for this opportunity.
Thank you so much, Dr.
And
Brown.
I'd like to introduce Dr.
LaVeist.
I would like to echo the remarks of my co-chair and thanking Governor Edwards for his leadership in appointing this task force, and thanking him for appointing me to co-chair this important task force. look forward to working with my fellow co-chair, Dr. Sandra Brown, and each and every member of this task force and getting to know all of you. As you all, many of you know, I am new to Louisiana and look forward to getting to know all of you and becoming a part of this vital community to improve the health of the state. I also look forward to the mission of this task to ensure that our recovery moves us forward to a new normal where all Louisianans have an equitable access to a healthy and long life.
Thank you so much, Dr. Leveist. And what we want to do now is get to know you all a little bit better. We want to know who you are representing and a little bit about yourself and your area of expertise. As we stated, this is an introductory meeting, and the meetings that will follow will certainly take a deeper dive into this work and roll up our sleeves and be ready to make a difference. So if you would, when your name is called, if you would please unmute your mic and simply introduce yourself. Dr. Leveist and Dr. Brown, I think we've introduced you all pretty well, right? Anything else you want to add?
I know that I've been covered sufficiently. I would just ask that in the interest of time, that we keep the introductions as brief as possible so that we can participate in the conference.
Perfect. Sounds perfect. Thank you so much. We will begin with Dr. Earl Nupcius Benjamin Robinson. And please, if we pronounced it incorrectly, please correct us. Dr. Robinson. Yeah, correct me.
No. It was fine. Fine. Good afternoon, everyone. I am Earl Benjamin Robinson, and I am the Deputy Director.
If you guys would mute your phones, please, so that we can hear one another, please. All right, Dr. Robinson, are you there?
Yeah, I'm here.
Perfect.
So I am Earl Nupcius Benjamin Robinson, and I am the Deputy Director of the Office of Community Partnership and Health Equity at the Louisiana Department of Health. My office is new. Over the last year, we have been in the process of developing the state's first health equity plan. It is the first health equity plan that is in a southern state, and I would even dare to say that it is the first health equity plan in the United States that really gets down to the nitty-gritty. Typically, health equity plans are very abstract, but ours is very specific, targeted in giving responsibility to offices inside LDH. I am an 18-year public health practitioner, and I am also at Xavier University, teaching inside the public health program. I'm so glad to be here with my colleagues, and I look forward to moving health equity work forward inside the state of Louisiana.
Wonderful. Thank you so much. Senator Regina Ashford Barrow. Senator, are you there? I know Senator Barrow was on for just a minute. All right, we will loop back with Senator Barrow. Let's move to Dr. Takesha Davis.
Yes, good afternoon, everyone. My name is Dr. Takesha Charles Davis, and I currently serve as the President and Chief Executive Officer of the New Orleans East Hospital, a proud member of LCMC Health. I am a physician by trade, a public health practitioner with over 10 years of experience in working in the Louisiana Department of Health, most recently as the Assistant State Health Officer, and currently the only African-American female hospital CEO in the state of Louisiana. The hospital that I shepherd services a predominantly minority community in New Orleans, over 85% African-American, 11% Vietnamese American, and I'm excited to be able to offer my lived experience and expertise to this committee.
Wonderful. Thank you so very much, and thank you for your commitment to healthcare. I understand Senator Barrow is, there she is. She's back on. Hi, Senator. Oh, she's muted. Let's see. Senator, if you can hear me, Make sure your mic is unmuted. Maybe I see you waving. Okay. She can hear me. Okay, we wanted you to give an introduction. We'll loop back and we'll try it one more time in just a moment. Dr. Rebecca G. Are you here with
Hi,
us?
everybody. Can you see me?
Yes. Hey.
Okay. All right, great. So I am an OBGYN by training, trained as a health services researcher, formerly chief medical officer for Medicaid, and led a birth outcomes initiative that had a focus on health equity. Was honored to serve with Governor Edwards during his first term and helped shepherd for him the Medicaid expansion, which I believe was very important to health equity. Started the first maternal mortality state-led effort with a focus on health equity in the country, where we've been able to reduce maternal avoidable poor maternal outcomes. We're very proud of. And then I established the Office of Community Partnerships and Health Equity, which was the first, as you heard from Dr. Benjamin Robinson, in the country, we think, with the type of action strategy or health equity action teams that are organized and have been deployed throughout the health department, including work that we did that was formative to look at our own ideas and attitudes as they related to our senior leadership and the impacts those had on our ability to lead and think of the other. We also focused quite a bit on racial disparities in our data, and we made sure to include those. And I think you can see some of the maturation of those efforts and the fantastic dashboards that we see now, which I'm very, very proud of, that we really have led under the governor's leadership, and now Dr. Courtney Phillips, who's the tremendous new secretary, efforts to describe this problem. And just wanted to thank the governor for creating this task force. Now at LSU and representing the doctors, nurses, allied health professionals, students here in New Orleans, who are going to tackle these challenges. And my hope out of this is that we come up with real solutions, continuing to address these challenges, but that we also train our workforce with a new vision for the future so that we do not have these disparities in these times of challenge. We don't want to just rebuild systems, the old systems back how they are. We want to break those up, see those go by the wayside and create new systems that are better for the future. So excited to be with you. Honored to be.
Thank you so much. Okay, we will now move to Dr. Corey Hebert.
Hello, everyone. This is Dr. Corey Hebert. I am a New Orleans dweller, but Baton Rouge native, and I am assistant professor at LSU.
Dr. Hebert. Dr. Hebert, are you there? I think we're having a breakdown in connection, if you can hear me. Dr. Hebert. Okay. Dr. Hebert, are you there? Okay. We'll also loop back with Dr. Hebert as well when we can hear him a little bit clearer. Let's move to Reverend Theron Jackson.
Hey, good afternoon to everyone. I'm Theron Jackson. I pastor at Morning Star Baptist Church here in Shreveport. I've served as a pastor in Shreveport for 22 years. Also, previously served in administration at Southern University on the Shreveport campus. I've in the city of Shreveport. I've been the elected city councilman, chairman of the city council. I've chaired our area metropolitan planning commission as well. Today, I'm representing as well. I'm one of the leaders of Together Louisiana, which has organizations in about 32 of our parishes around the state, and also a group of pastors called Nehemiah Faith-Based Coalition. So I just want to say that it is my privilege to be here. I want to thank the governor, the administrative portion of this task force, those two co-chairs. Thank you for your leadership as well. It's certainly my privilege to be here with so many of you who I think are on the front line doing what matters and who represent what I think is the best in brightest in Louisiana. It's my privilege just to be a citizen. I feel like I'm sort of appointed as an interpreter because everybody in our community doesn't speak healthcare, everybody doesn't speak public health. And I think I want to interpret to the people who live in our community what you're saying, and interpret for you what they're saying. So I heard the governor say there have been a lot of pre-existing conditions. I think he referred to them as comorbidities. People in our community don't necessarily speak comorbidities, but I do think that that was a significant list of things that do affect people who live in the community where I serve. But I also want to add, as this committee does her work, that we should add to the list of comorbidities, discrimination, racism, income inequality, and those things that when epidemics and pandemics come, exacerbate the people in our community's ability to try to negotiate life. So it's my privilege to be able to serve, and I'm looking forward to gleaning from each of you professionals who are
Thank
part
you.
of
Thank you
this.
very much for those words. And we will now move to Mr. Raymond Jetson.
Good afternoon to everyone. I'm Raymond Jetson. I currently serve as the Chief Executive Catalyst at Metromorphosis, which is a not-for-profit based here in Baton Rouge that is focused on the premise of the transformation of inner city neighborhoods by building upon the assets that exist therein. I served 4 terms in the Louisiana House of Representatives, formerly served as the Deputy Secretary of the Office for Citizens with Developmental Disabilities and as the Deputy Secretary of the then Louisiana Department of Health and Hospitals. I'm excited to be a part of this, to learn, and to contribute where I can. And thanks to Governor Edwards for his leadership and for the opportunity to serve.
Thank you. Thank you, Mr. Jetson. Good to see you. We're going to loop back now to Dr. Hebert. I think we have him back with us. Dr. Hebert.
Yes.
Perfect. I think we can hear you
Yes.
now.
Sorry about that. I
Awesome.
don't know what,
No
in
worries.
this age of COVID-19, you never know what to expect.
That's right.
So this is Corey Hebert. I'm a practicing physician in New Orleans, Louisiana, but born and raised in Baton Rouge. I'm assistant professor at LSU and Tulane and chief medical officer at Dillard University, former chief medical officer of the Louisiana Recovery School District, and former chairman of the National Advisory Council for the National Health Service Corps. I am also the chief medical editor of NBC Television for the Gulf South region and Black News Channel out of Atlanta, Georgia, and Tallahassee, Florida. So my goal in all of this is to make sure that the messaging is right. What we find is that we're shining a light on this, but the light has actually been shining. It was just a very dim candle. Now we have an LED floodlight, and that's what we must do to make sure that the messaging is right, because people actually know what they need to do. Almost, they just need to be inspired to do it. So messaging, and I just want everyone to know that I'm fully vested in this committee, and anything that I need to do, I am willing to do. So thank you very much.
Wonderful. Thank you so much for that introduction. We will now move to Dr. Peter Kaczmarek.
That wasn't bad at all.
Wasn't bad. I was waiting for you to correct me.
So, it's Peter Kaczmarek here at the Pennington Biomedical Research Center in Baton Rouge, where I serve as the Associate Executive Director for Population and Public Health Sciences. And my area of research really focuses on the health disparities in physical activity and obesity and other health outcomes. And as we know, obesity is a public health issue in its own right, particularly in Louisiana. And so this intersection of health disparities and obesity now with this pandemic, I think is that intersection is something we're going to need to focus on. I'm very excited to be here, and on behalf of Pennington, we're happy to be involved with this work. So thank you.
Wonderful. Very glad to have you. And it looks like also Senator Barrow is back on. Can we hear you now, Senator?
Can y'all hear me?
Yes, we can hear you. Welcome. Good afternoon.
Oh my God. Thank God. Good afternoon, everybody. I am actually kind of moving, but I just want to say, first of all, how appreciative I am to the governor for actually pulling this task force together. I want to say thank you to Southern University and to all of the partners who have agreed, and all of the individuals who have agreed to be a part of this real important work. I am a state senator and have been a senator for now 15 years, going on 15 years. And this is always been one of my premier issues. I have served on the Health and Welfare Committee since I've been elected. And about 2 or 3 years ago, I introduced legislation called Empowering Families to Live Well to deal with the underlying issue of what I believe is the root cause of what we are seeing today, which is poverty. And so I am committed to this work. I'm looking forward to working with the task force, and I'm looking forward to bringing real, tangible results. And I've heard that word a lot today, but I'm looking forward to bringing real, tangible results so that we can see our state move up and our citizens be more healthier.
Thank you, Senator. It's always great to see you, and you
Thank you.
certainly have been a champion relative to this work. So glad to have you on board. We'll now move
Thank
to
you.
Dr. Kathleen Kennedy. Dr. Kennedy.
Good afternoon, everyone. My name is Kathleen Kennedy. I'm the Dean of the College of Pharmacy at Xavier University of Louisiana here in New Orleans. I was the first director of our Center for Minority Health and Health Disparities Research and Education. Our focus has been on building the infrastructure needed to conduct health disparities research, but also engaging community outreach so that we work with the communities to provide support based on what their needs are. About 13 years ago, I established the first health disparities conference for mid-level providers, and that's been continuing. It's a national conference where we're bringing together people from all backgrounds, health professionals as well as policy makers, so that we can attack the entire spectrum of what causes health disparities, the social determinants of health in particular. And the goal there was to bring people together to share ideas so that they make the changes that we discussed. So I'm really excited about this opportunity. I work with several organizations that focus on community outreach. We also focus on cultural competence, ensuring that our graduates are trained to interact with people from all backgrounds, and health literacy. And I heard the pastor talk about how the community members don't really understand some of the language that we use. And I think that's very important as we move forward. So I'm excited about this opportunity to work with all of the experts here on the call to make some changes and to impact the communities that we serve. So thank you very much.
Thank you, Dr. Kennedy. We're certainly happy to have you on board as well. Mr. Mike McClanahan, are you there, sir?
Yeah, I'm here. Can you hear me?
Yes, sir, we can. Loud and clear. Good to see you.
Good. I'd like to say good afternoon to everyone. I'd like to thank the governor for listening to the cries of the community and recognizing that something must be done and doing something about it by appointing a task force. I'd like to thank Southern University, my alma mater. That not only gave me my start, but also my daughter. She's a nurse practitioner, a start in the field of healthcare. And we've been around. I'm NAACP State Conference president. We've been around since 1909 nationally and 75 years in the state of Louisiana, fighting just what we've gotten together to do. Fight to find the inequities that exist in our healthcare system and to do something about it. I've heard a lot of talk about studies and what have you, but now it's time to put a report together and find those solutions that we need to find now. If we don't get those solutions to enact right now, I think it'll be a generation from now. But I think we're in a good position to do that. The NAACP is here. We're in 40 of the parishes, and we're in 11 of the university colleges here in the state of Louisiana. We're prepared and we're situated to do what we can to help in this pandemic age. I'd like to thank you all, and I'm here to assist whenever.
Wonderful. Thank you so much. And another Southern University recent recruit, Dr. Orlando McMeans, our Chancellor of the Southern University Agricultural and Extension Center. Dr. McMeans.
Good afternoon, everybody. And thanks for that introduction. I don't have to go into that. So I, like Dr. Williams said, I'm relatively new. I spent the last 23 years at West Virginia State University as the Vice President of Research and Dean, and I've been here for 7 months as the Chancellor Dean at Southern University Ag Center and College of Agricultural, Family and Consumer Sciences. My background is horticulture and plant molecular biology. So I hope that my background and experience, especially in agricultural production of fruits and vegetables, which is an area that I worked in for almost 30 years, will be of interest. I am currently the Policy Board of Directors Chair of the Association of Public and Land Grant Universities, and we represent all of the land grant institutions in the country. And we just took a vote to propose a lot of the initiatives that we're looking at addressing in the state of Louisiana. And this is around producing fresh vegetables and fruit. It's about dealing with individuals who don't have access to those types of produce. These individuals in food deserts, and also looking at the expertise that's going to be needed to address some of these issues. So I'm truly excited about being a part of this. And what I would hope is that I would bring the collective expertise of the Ag Center and the College of Ag at Southern University to this committee so that we can lend that collective expertise to advance this mission of this task force. And I look forward to working with each and every one of you.
Thank you, Dr. McMeans. We will now move to Representative Dustin Miller. Representative Miller, are you there?
Okay. Yes, I'm here. I'm sorry. I just walked in the GoTel building. I have my mask on, so I'm not sure if y'all can hear me well.
We can hear you, sir. Well, we
in the back of the committee. I am a representative. I'm not practicing trade, also a graduate of Southern University under the great Dr. Brown. And I just want to say it's an honor to serve. I can't wait to meet all of the good individuals and qualified individuals that's on this committee. We all know we have plenty of challenges ahead of us, but Dr. Gee, she's equity issue. I know about work, but we've also reached a lot of roadblocks that I'm excited and can't wait to share that so that we can get the opinion of a lot of the experts. They've also had a lot of work done through people that was hired to help research. And for instance, just recently, a lot of people getting fools with Medicaid, and the challenge was we couldn't get them to let them rescind. So that was a big issue that I don't know if we ever really solved. So I'm gonna keep it short. I know the governor's about to start, but I just want to say for serving, I'm looking forward to it, and can't wait to work.
Thank you so much, Representative Miller. We'll now move to Ms. Judy Reese Morse.
Good afternoon, everyone. I am thrilled to be a part of this very important task force. Absolute thanks to Governor Edwards for the bold decision to create a task force and to disaggregate the data by race so that we all can see exactly what work we need to do in order to address these historical issues. We know that there are a lot of challenges across the country, and most people don't want to take this issue on, and they don't want to put a racial lens on it. But we also know that unless we do that, we're never going to find the solutions that we believe are out there, but we won't get to them unless we take an honest look. So thank you again, Governor, for that and the work of your team, as well as including the Urban League of Louisiana as a member of this task force. Many of you here know the work of the Urban League historically, nationally, as well as in New Orleans and now across the state of Louisiana. I hope that the Urban League will continue to be able to bring forward the voices of those that we serve, whether they are parents, job seekers, entrepreneurs, returning citizens. We touch a vast number of people in a number of different areas. And I will call your attention to a document that we released this week called Recover, Reform, Reopen, where we have raised many of the issues that we've heard from the people that we serve. We've also tried to keep dialogue and conversation going through town hall meetings. We had a really successful one last week called We Are Not Immune, speaking about the impact of COVID-19 on African Americans. And in partnership with the Louisiana Legislative Black Caucus, we will do a 4-part series next week looking at the social determinants that contribute to the health disparities that we are seeing. So delighted to be a part of this, excited, ready to get to work, and so honored to be able to work with all of you as
Thank
a part
you.
of this
Glad
effort.
to join
Thank you
forces
so
with you
much.
guys again to do this important work here.
Thank you.
All right, we will now move to Dr. Demetrius Porche.
Good evening. My name is Demetrius Porsche. I'm pleased to serve on this task force also and join all my colleagues. I currently serve as the Dean and Professor of the School of Nursing at LSU Health New Orleans. And I am also the President of the Louisiana Council of Administrators of Nursing Education, which represents all schools of nursing throughout the state of Louisiana. I also have the privilege of chairing the American Association of Colleges of Nursing's Diversity, Equity, and Inclusion Task Force and Committee. So it's my privilege to bring over 30 years of community public health nursing experience to the task force. And I've also had the opportunity to work in the previous pandemic of HIV infection very early on when the infection first emerged, and also did some work in the African American community at that time. So I'm looking forward to the work, and hopefully we can also come to some real solutions.
Glad to have you, Dr.
Items.
Porsche. Thank you so much. And another one of Southern's very own, Dr. Ronnie Whitfield, of course, member of our Southern University Board of Supervisors. Good to see you again, 2 times in one day.
Awesome, awesome. Great to see everyone. Good afternoon, and thank you for the opportunity. My name is Ronnie G. Whitfield, also known as a hip hop doc, as I use music and medicine to educate young people on health issues. I'm a proud husband and father and a lifetime native of Baton Rouge. I also practice family medicine and sports medicine here in the city with Our Lady of the Lakes Physicians Group. I'm a current member of the Southern University Board of Supervisors, a national spokesperson for the American Heart Association, and a member of the Governor's Council for Physical Fitness and Sports. I just want to thank the governor and all of you for volunteering to be a part of this themed task force. And I know that our response to the pandemic will be unified and evidence-based. So thank you for the opportunity.
Thank you, Doc. And we will now move to Dr. Gary Wiltz. Is Dr. Wiltz on the phone? Did he join?
Yes, I am. Can you hear me?
Perfect. Yes, sir, we can. Welcome.
Sorry, I was a little late. I was in another Zoom meeting. I am Dr. Wiltz. I'm the CEO of Test Action Clinics, Louisiana's oldest community health center, established over 45 years ago. I'm a native of New Orleans and born at Big Charity Hospital back in the days when it was segregated on the colored ward section. Was educated in the public school system of New Orleans and went to undergrad at Tulane Medical School, and did my residency at Big Charity. I think I've been, and I represent FQHCs, of which are serving 450,000 people in the state of Louisiana. And I too am honored to be on this committee. I recognize a lot of the names. I've worked with a lot of folks. I think I've been on every healthcare task force going back to Edwin Edwards over 40 years now. And this is an issue that's near and dear to my heart that we've been working on for so many years. And I'm just excited to be a part of this. I've had the experience of being chair of the National Association of Community Health Centers that serve 30 million people in the United States, and also have had a chance to do work with the National Service Corps. I chaired the Advisory Council for that. More recently, I co-chaired the Governor John Bel Edwards' healthcare transition team, and was a part of that, and look forward to working with this. And I guess my thing is, I've always said that no one can save us from us but us in the state of Louisiana. And I know that we have the talent, and I know we have the resolve and the reserve to get this done. And I'm so sick and tired of being sick and tired of writing every grant that I've written for 40 years, leading off with Louisiana ranks 48, 49, 50th. And thank God for Mississippi. I'm just delighted to be a part of this committee, and I'm hoping that we can put together something that's going to be a generational, transformative opportunity.
Very well said. Thank you so much, Dr. Wiltz. We look forward to it as well. And Dr. Jan Ross, are you there?
Yes, there's no doctor on that one. I'll be one of the few that does not represent medical field. But thank you very much for having me join this. I represent the Huey and Angelina Wilson Foundation. I'm Executive Vice President of Philanthropy for the foundation. And also in partnering with Baton Rouge Area Foundation and Pennington Foundation as what was described by the governor. So thank you all very, very much for participating on this task force. The responsibility is great. As you all have said in multiple instances, we're tired. We're sick and tired of the rankings that Louisiana has. And so that leads to some very tall orders for you guys to come up with, to use the data that is available to you all and come up with the solutions that are truly implementable by our communities, recognizing that our state is a multitude of different types of communities, New Orleans being quite different from other parts, as well as Baton Rouge being very different from other parts of the state. And so I hope that you all are ready for the challenge. It's a very tall order, and I feel like with the credentials that you all have described, you all are very qualified to do this. I look forward to staying up to date with what you all are doing, and look forward to see what the recommendations are so that we as investors in the community can take that on and help implement along with the rest of the community. So thank you all very much for your time, for your commitment to this, and your willingness to serve for the governor.
Thank you. Thank you, Ms. Ross. And as you stated, the responsibility is indeed great for this committee. But we do have an impressive cadre of thought leaders from varying backgrounds that we know will contribute and really make progress towards our end goal. We are about 3 minutes shy of the governor's daily announcement. Just want to let you all know that we anticipate this executive committee of the task force to meet weekly and virtually, of course, until further notice. We're going to be sending some communication to each of you. We're going to need to make sure our rosters are correct in terms of your cell phone numbers, or email addresses, the way that you would like to be acknowledged, the spelling of your name, and just really to do some cleanup work to that end. Also, just so that you all know, the governor has also identified a group of subject matter experts who will provide recommendations and input by serving on various subcommittees of this group. So the subcommittee members are going to meet separately in their respective areas and provide data and support to this executive task force. So we're very much appreciative of all the subcommittee members who are not on the call today, but they will definitely be engaged in this work. Task force co-chairs would like to meet again weekly. Our next meeting is going to be May 1st. It will be at 2 o'clock. We will be sending more information. Dr. Brown and Dr. Leviste, do you want to make any closing comments? Yes,
Katara,
ma'am.
Dr. Williams, can you hear me?
Okay.
Yeah, I have to run, but I am just encouraged by the cadre of excellence and distinguished members of this board. We've got tall orders to do, but I am confident that we will deliver. We can, we will, we must. So I'm being called to this press conference, but I'm going to sign off, and we will meet again next Friday at 2 o'clock. Thank you all so much.
Yes. And I won't hold you on any longer as either, except to echo my co-chair's words. Look forward to working on this. I know I, for one, have been working on the health disparities issue, health inequalities issue for the last 30 years, and have an opportunity now to make a difference in a state that needs it, a state that I moved to specifically because it was a state that needed it, where I thought that I could help and be a part of that, of moving to Tulane School of Public Health into addressing health equity and addressing it in a state where we have an opportunity to make a difference. And I'm so pleased to be in this role and so happy to have an opportunity to get to know all of you and bring our collective genius together to address the health of the state of Louisiana. Thank you all for being to serve.
Wonderful. And again, we'll be reaching out to you individually. I think the co-chairs will also be reaching out to you next week on the 1st. We will be taking a much deeper dive and have a lot more dialogue. We really just wanted to get together. We wanted the governor to, of course, to give us the charge, and then, of course, to get to know one another and our backgrounds. Next week, we'll be rolling up our sleeves and really diving in to the work. So please expect some calls from the co-chairs and others relative to moving this committee forward. Are there any additions before we adjourn? All right, hearing none, we hope you all have a wonderful weekend. You'll be getting again some emails from us, and we will talk to you on the 1st. Thank you all so much. Have a great weekend.
Thank you. Bye-bye.
Thank you.